channel is Shay Michelle, and I'm so happy that you are here to join me for another video. This is like a one-in-a-kind video. It's been done on my friend's channel, but not on my channel, so it's a one-of-a-kind for Shay Michelle. Today we are actually doing like a med school versus like dental school vlog like comparison, because you know they're both doctors, they're both kind of like in the same sphere of things. However, you know what we learn is extremely different. So me and my friend Eli are going to be doing a video all about that, and I am so excited because I've been waiting to do this video and it's amazing. We have a jam-packed day, and so just to give you a rundown of the day for my schedule, today I have multiple required classes, so it is going to be an interesting one. From 8:30 to 9:20 I have a pharmacology lecture, estrogen and progesterones. Then from 9:30 to 10:20 I have pathology. Then from 10:30 to noon I actually have a pathology lab, and so that's when we're in our small group settings and we're like looking at literally specimens, and we're like, do you see goblet cells? Is this exocrine or endocrine? Like all of that. And then from 1 to 1:50 I have another lab, but this time for microanatomy. Same idea of looking at slides and being like, is this necrotic? I kind of flip those around. Necrosis goes with pathology and then the cells go with micro, but you get the gist. From 2 to 2:50 I have a very interesting course. It's called Foundations of Physician Resilience, because you know as physicians you come into contact with a lot of different things, and you know a lot of different people, and you know just in a way you just hear so many different stories that you know are not always the most uplifting things. And, you know as a physician you have to be able to like work through that with your patient and also work through it within yourself. So that's what today's conversation about. And even after the talk from 3 through 50 we have literally a like a post-session support, because I think it's going to be a very, very deep conversation happening. After the actual talk, I'm going to practice for my OSCE exam with some friends. And so basically in medical school, we get assessed on our like clinical skills via the OSCE. We have 20 minutes. We go into a room and then we get there's a patient in there, and so they have a specific kind of like illness that they're portraying or some type of problem. So say it's a heart problem, right? And so I have to know as a student, like, okay, what are the components of a cardiac physical exam? And I need to execute those along with doing all of the history, such as one, the history of present illness, the social history, the familial history, the surgical history, the past medical history, in addition to the review of symptoms. And so I just need to go through all of that, well, most of it, correctly. And that's kind of our assessment for medical school. Eli's going to tell you a lot more about the assessment in dental school. It's going to be a jam-packed day, and I'm excited for you guys to kind of like see the comparisons in both of our days. Stay tuned for all of this, and I will see you guys when I'm on my way to class.
To run the EM.
What's up, y'all? My name is Eli. I'm a first year dental student at Boston University Henry M. Goldman School of Dental Medicine, and today I'll be bringing you guys along for a day in the life of a dental student. So me and Shannon did a video, med school versus dental school, on my channel not too long ago. You guys can all check that out when you're done watching this video. Just like a brief introduction and a little bit about myself. My name's Eli. My YouTube channel is Student Dr. Eli. I make vlogs, dental school vlogs on my channel, and I'm a first year dental student at Boston University. I wanted to give you guys like a brief outline of what my day looks like today. So you guys already saw me log in for my 8 a.m. class on Zoom, and I have a few other things to do today, but I will say that class-wise, this is not a typical day for me. We are 10 days away from our final, our last exam of our first year. This morning was actually my very last class. The next 10 days, anything that I have to go to school for is just exams. Essentially today I had class from 8 to 11 on Zoom. At 11:30 I have a meeting for the orientation ambassadors. After that, probably gonna go to the library or go to the med school, one of the classrooms, and study for one of my exams that I have on Wednesday. And then maybe or maybe not, I don't know if I'm gonna go to the gym yet, but I'm also planning on going to the sim lab because I have a summative exam on Thursday. So in dental school, you start learning how to do procedures in your first year, whether it be cavity fillings, whether it be with silver fillings or tooth colored fillings. And at the end of the year, we have a summative exam, which is essentially testing us on how well we can do these procedures. Last week, we had our first one, which was Class 3 composite. This upcoming week, we have another summative exam on a silver filling. That's about it for the introduction, so come along with me through my day, and I hope you guys enjoy watching this vlog. It is now 10:49. So I have my meeting at 11:30. After that, I'm gonna go to med school, study with a classmate, and then I may come home and change into scrubs before going back to the sim lab. We'll see later. But yeah, it's 10:50, and I'm leaving for school. Just dropped off my COVID test. I had to take my jacket off because after all that walking, I felt like I was gonna sweat, and I got a gray shirt on. And that's a no-go, but I'm walking over to the dental school now.
Morning. Welcome to BU.
This is Ruth. She's a
Hey
D2.
guys.
Almost a D3, which means, what does that mean in dental school?
I start seeing patients.
Yeah. Ruth, how do you feel about the fact that you're going to be seeing patients literally in July?
Starting August. After first year, I was like, wait, how am I supposed to be ready to see patients third year? But I will say though, this second year, we have been in the lab so much, like almost every day. So I do feel a lot better. I'm nervous, but I'm really excited. I feel like I'll be okay.
I'm in the dental school now. It is 1:25. And now I'm gonna start studying for my exam on Wednesday. Got my laptop, iPad, the old school notebook. Studying for pathology.
It's noon. I just got out of class. I'm halfway done. I'm actually about to go and get lunch with two of my friends, a little catch up. And so we're just gonna like, not even get lunch, really just eat the lunch we brought. What is this like? But yeah, on that note, the day is far from done. We still have our one more class from 1 to 3, or no, we have a 1 to 2 and then a 2 to 3, which will be very interesting. I'm still at school, kind of. I'm not by the aesthetically pleasing signs, but on my way to eat. And then we have a few more classes until we start practicing our physical exams. Just got out of my last class, you guys, so it's time to practice some physical exams with my friends. And it is what time is it? 3:14. So, okay. So now me and my friends are about to practice our physical exams, and I've come completely geared up with everything. We have the stethoscope, we have a white coat, and so yeah, we're just gonna practice this. Again, we have 4 physical exams that are possibly gonna be on our test: the ear, nose, neck, head, throat, that iteration, cardiology, pulmonology, and then the abdominal exam. Basically on Tuesday, we're gonna get a case, not know what it is, and then walk in and have to figure it out. So we're all about to practice that, along with all of the different histories we have to take with that. Afterwards, I don't know what I'm gonna do. I have some lectures to catch up on. I may go work out, but who knows? But let's get to these exams. Honestly, I'm just having really bad chest pain. Oh, no, okay, so have you lay down? And the first thing I'm gonna do is I'm just gonna take your pulse, which is your heart rate, okay? So put your hand out like this for me. I'm just gonna, yep, also strong. I'm just gonna pull your sock down a little bit. Okay. Get your pulse down here if you don't mind. No problem. Okay, everything sounds great to me. I'm just gonna do some pressing on your stomach again. Let me know if you have any pain. Okay. I'm so sorry. I'll do it right here. Yeah, okay.
It's 4:35, and we're being mad productive today and studious. So we're going to the sim lab. I'm gonna do a class 2 amalgam prep, which means a silver cavity filling. I like never change this. No, but I just remember the first time. Oh god. I am at my locker, about to put my stuff back, and finally head home for the day. It's 5:40 right now. I'm gonna go home, study some more, and then probably go to the gym later.
I'm finally back to my room, and it is 5:01, 5 o'clock, man. Today was a long day, but I don't know why I got such a burst of energy midday. Now what I'm actually going to do is I'm actually going to do a ton of flashcards in order to go through all of the material that I've learned in lecture. And so one thing I really like here is we have like this Dropbox that everybody puts lots of information in. So someone has made flashcards pertaining to every single lecture, and it's so good to like look at these flashcards right after lecture because it kind of reiterates the information to you. And I'm not gonna lie, I've been slacking. Today is like Thursday and I have not done the flashcards since Monday. So on that note, what I'm going to do is I'm about to catch up and do all my flashcards for Tuesday, Wednesday, and today's lectures, and then hopefully, you know, I can get something else done. But that's the gist of what I'm about to do now. Let's get to it. I just did about 200 of my flashcards, and I'm not gonna lie, it's like I feel like I barely did anything, but simultaneously I'm like, I did so much, I deserve a break. So I just wanted to share what I do in these moments, honestly, when I'm like just a little less motivated to do all of my studying, just because, you know, I'm not on a time crunch. There's nothing like forcing me to study. So sometimes, you know, it's hard. And in these times, I like to kind of like, one, just acknowledge like it is totally okay to like not want to study all the time. I think especially in graduate school, there's so much information you have to learn so quickly and retain it all. And so I think a lot of times we don't give ourselves grace when it comes to like, if you don't feel like studying, like not taking breaks, not taking naps, not going to get some food, not hanging out with friends. And so I really like to emphasize in these moments, because I'm seriously having one where I'm just like so distracted for no reason. It's like I do 20 flashcards and then I'm picking up my phone, going on random apps. I'm Googling things that have nothing to do. I'm looking up restaurants. Like I'm doing everything else but what I need to do. So what I do in these moments is I like to just acknowledge it, like reassure myself that it's okay, because it's 6:30 right now, and even though I may not want to study now, maybe at 8 o'clock I'm gonna be like grinding it out and just being so motivated, because you know, you kind of fluctuate with things. And also acknowledge today was a long day. I think for both Eli and me, today is a long day, you know, filled with a lot of things, whether it's like socially, academically, physically, emotionally, everything in itself. I think for Eli and I, it's going towards the end of the school year, and I feel like this is where you feel like the most fatigue and simultaneously have like less work, but may not necessarily be easier work. It may be like a lot more complicated because, you know, we were first years only a few months ago, but we have learned so much in this like short amount of time. And so this is just a PSA that's like totally cool. If you're an undergrad, if you're in high school, you feel this, I'm sorry to tell you, but it does not go away. It, you know, of all things, you just feel the fatigue more. But I think this is the time when like your determination and your real passion shines through. You know, I just want to announce that I'm taking a break. I'm gonna watch some Netflix.
It's now 7:33 and I am finishing up some studying for the night. I'm gonna call it quits at 8 o'clock, go to the gym for an hour, come back, shower, relax. I might study late tonight because I don't have class tomorrow. Like I said, today was my last class of my first year of dental school. A full day of studying tomorrow before my exam on Wednesday. So hope you guys enjoyed watching today's vlog. I hope you guys can see the differences between your first year in medical school and dental school, while also seeing some similarities. Thank you, Shannon, for having me on your channel. Make sure you subscribe to Shannon's channel. Make sure you subscribe to my channel, Student Dr. Eli. And I'll see you guys on my channel if you decide to come. Thanks, Shannon, and I hope you guys enjoy. Peace.
There has been an exciting change of plans. It's 9 o'clock and I'm actually about to go to a wine night at one of my friends' place. So on that note, you guys, make sure to check out Eli's YouTube page and the video we did before. I'm gonna have literally everything linked below. Again, like, thank you, Eli, for doing this video with me. And then thank you guys for watching it. Don't forget to like, comment, and subscribe to my channel and his channel. And then I will see you guys in the next video. And don't forget to stay tuned if you